The community that we're working in is Siler City, North Carolina, in Chatham County. The entire state has undergone a huge change demographically since 1990, with probably close to a 400% increase in the Latino population. This was not a state that was prepared for that in any way, and it really did happen very rapidly. There were lots of jobs in North Carolina, lots of new construction, lots of chicken plants that were employing folks, and so folks were coming up and they were staying and settling. But we didn't have teachers that spoke Spanish. We didn't have ESL teachers. We didn't have healthcare providers, mental health providers no less. So there simply were not people in the community that were able to make a bridge, even just from a simple linguistic standpoint, to this population 15 years ago. In our work in Chatham County, what we discovered is that we're not only reaching out to the Latino immigrant community, that we're really reaching out to teachers, to other service providers, and that there's a wide net of people that maybe need to look at their work in a different way. And what we realized as we got into this is that I do this work with new immigrants because I choose to. Alejandra does the work with new immigrants because she chooses to. But there are others in this partnership that have become part of our partnership that don't necessarily start from that place.
One of the best parts of Bridges program is that from its very inception and implementation, the community has been a part of even the program development. And so they brought in the community partners, which included social service agencies as well as faith-based organizations, to be a part of that process, and to be a part not only as partners to provide the linkage to the families, but also to provide information, to provide support, and to provide ideas as to how the program should be established, designed, and implemented. And unlike other programs, it has continued throughout the implementation of the program, which has been very respectful to the community at large, and also respectful to the families who are part of this project.
I think one of the critical things for us, especially because the immigrant populations we're serving are very new residents to our community, is that services have to be delivered in a way that mental health is normalized and it's destigmatized. So at one level we do that by providing the services in the school, where children are spending their day, a large proportion of their life. But really beyond that, we've situated our services within school-based health centers. And for many children, this is where they're actually receiving their primary medical care, so that children will come to that health center for routine medical complaints, illnesses, and often those complaints turn out to have more of a psychological or psychosocial basis. So really it becomes an entree to really a model of wellness, rather than identifying those kids who are the problem child or the one that's creating the highest level of disruption in the classroom. And I think for families for whom mental health or mental health services are a novel concept, that really goes a long way toward both destigmatizing and making those services more accessible.
This program is a how-to for issues that are affecting communities across the country. And the first time some teacher looks at a sobbing child who cannot even communicate with the teacher in the English language, and she can't help, and she doesn't know what to do, and the reason she's a teacher is she's a helper bee, that's where Caring Across Communities comes in. Because until there are programs where people who recognize the realities and also have begun to figure out what the right interventions are, you simply have a crisis that everyone feels helpless in. And this takes people from feeling helpless to feeling competent and being able to move on and help other people. The implications of this kind of program go beyond specific projects. They go to helping members of a community come together and figure out how to be successful in taking a family that's had very difficult experiences, and suddenly that child is able to do well in school, and moms are able to come and help out in the second grade, and families feel less frightened, more competent, more capable, more hopeful. And people in their community can see that the problems that came with them do not have to be the problems that take them into the future.
It's how you define mental health. If you just look at it just purely from a clinical standpoint, schizophrenia, bipolar disorder, from a disorder standpoint, you can look at it as a disease or disorder that we ameliorate the symptoms through medication or therapy and so forth. For me, it's more than that. It's helping the individual understand the environment, helping them understand how to communicate. Because especially with immigrant refugees, when they come into this culture, they really don't understand the norms, the rules, the regulations, the social discourse. For me, that's part of mental health.
Probably one of the most important reasons that school-based services, I think, are so effective is that you have access to teachers and to other important stakeholders in a child's life. What you do is not that just that you provide services somewhere where children are 8 hours a day or 6 hours a day, sometimes more, but that you are consulting and working side by side with educators and administrators who may not understand the importance of mental health, but with our assistance can really learn how mental health impacts education and are the most important partners in effectively reaching kids.
I think what is so admirable about what has happened over the last several years in terms of the Foundation's participation is that as an institution, they took their nearly 30-year history in focusing on improving the health and health care of Americans, identified a vulnerable population, the new immigrants and refugees that have been streaming into this country in great numbers in the last 2 decades, saw the unmet need, and looked at something they've been doing fairly recently, school-based and school-connected care, and figured out a new model for how we could fairly rapidly expand services for a population that had a lot of needs. And for that, we're all very grateful.
One time or another, all of us need help, little bit of help. And that little bit of help makes a long-term difference.